A pacemaker is a small device that's placed under the skin and chest to help control heartbeat. It's used to help heartbeat more regularly if an irregular heartbeat, arrhythmia, particularly a slow one. Implanting a pacemaker in chest requires a surgical procedure. A pacemaker system includes a pulse generator and one or more electrodes, leads. Pulse generators are placed in a subcutaneous pocket created in either a subclavicular or underneath the abdominal muscles just below the rib cage. Electrodes, leads, may be inserted through a vein, transvenous, or they may be placed on the surface of the heart, epicardial. A single-chamber pacemaker system includes a pulse generator and one electrode inserted in either the atrium or ventricle. A dual-chamber pacemaker system includes a pulse generator and one electrode inserted in the right atrium and one electrode inserted in the right ventricle. In certain circumstances, an additional electrode may be required to achieve pacing of the left ventricle, biventricular pacing. Cardioverter defibrillator. A pacing cardioverter defibrillator system includes a pulse generator and electrodes. It requires multiple leads, even when only a single chamber is being paced. A pacing cardioverter defibrillator system may be inserted in a single chamber, pacing the ventricle, or in dual chambers, pacing the atrium and ventricle. Transvenous pacing, temporary. Transvenous pacing, when used for temporary pacing, is an alternative to transcutaneous pacing. A pacemaker wire is placed into a vein, under sterile conditions, and then passed into either the right atrium or right ventricle. The pacing wire is then connected to an external pacemaker outside the body. Transvenous pacing is often used as a bridge to permanent pacemaker placement. It can be kept in place until a permanent pacemaker is implanted or until there is no longer a need for a pacemaker and then it is removed. Permanent transvenous pacing. Permanent pacing with an implantable pacemaker involves transvenous placement of one or more pacing electrodes within a chamber, or chambers, of the heart, while the pacemaker is implanted inside the skin under the clavicle. The procedure is performed by incision of a suitable vein into which the electrode lead is inserted and passed along the vein, through the valve of the heart, until positioned in the chamber. Types of permanent pacemakers. Single-chamber pacemaker. This type usually carries electrical impulses to the right ventricle of your heart. Dual-chamber pacemaker. This type carries electrical impulses to the right ventricle and the right atrium. Biventricular pacemaker. This type of pacemaker stimulates the lower chambers of the heart, the right and left ventricles, to make the heart beat more efficiently. Insertion of new or replacement of permanent pacemaker with transvenous electrode, S. Atrial. Ventricular. Atrial and ventricular. The vein is penetrated with a large needle and a wire is passed through it. A fluoroscope is used to guide the wire into the right atrium. A pocket for the pacemaker generator is created and the wire is tested. The wire is connected to the generator and the generator is closed in its pocket. Insertion or replacement of temporary transvenous single-chamber cardiac electrode or pacemaker catheter. Insertion or replacement of temporary transvenous dual-chamber pacing electrodes. Temporarily placed outside the body. Insertion of a single transvenous electrode, permanent pacemaker, or implantable defibrillator. Insertion of two transvenous electrodes, permanent pacemaker, or implantable defibrillator. The insertion of a transvenous electrode is done when there is a problem with the electrode wire of the single-chamber permanent pacemaker or single-chamber pacing cardioverter defibrillator. The generator is removed and the wire is first tested. When the wire is found defective, another transvenous electrode is inserted. Access to the central caval veins is obtained through the subclavian vein or jugular vein. The vein is penetrated with a large needle and a wire is passed through it. Fluoroscopy, separately reported, is used to guide the wire into position. The wire is connected to the generator and testing is done again. Report 33217 if both electrodes on a dual-chamber permanent pacemaker or dual-chamber pacing cardioverter defibrillator are inserted. Insertion of epicardial electrode, S, open incision, e.g., thoracotomy, median sternotomy, subxiphoid approach. The physician places one or more electrical leads on the outside of the heart, epicardial electrodes, by open chest incision. The incision can be in the middle of the chest, midline sternotomy, a vertical incision just below the ribcage, subxiphoid, or between the ribs on the left side of the body, thoracotomy. The chest cavity is opened. After the heart is exposed, electrodes are affixed to the appropriate areas of the heart muscle. The electrodes are tested and then tunneled under the costal margin to the upper abdomen to a pulse generator or to the infraclavicular area if the generator is in that area. The physician closes the incision in layered sutures. Insertion of epicardial electrode, S, endoscopic approach, e.g., thoracoscopy, pericardioscopy. Two additional trocars are placed under thoracoscopic visualization in the inframammary anterolateral region. Under thoracoscopic guidance, the pericardium is grasped and incised. The lateral trocar is removed and the incision enlarged to allow passage of the epicardial electrode placement device and the electrodes through the intercostal space. The electrodes are placed intrapericardially. The pericardium is approximated with a single stitch to hold the electrodes in place. The electrodes are tested and then tunneled under the costal margin to the upper abdomen to a pulse generator or over the ribs to the infraclavicular area if the generator is in that area. The thoracoscope is removed and a thoracostomy tube is placed at this site. The lung is expanded and the incisions closed in layered suture. Insertion of implantable defibrillator pulse generator only, with existing single lead. With existing dual leads. With existing multiple leads. AICD pulse generators are implanted subcutaneously, usually in an infraclavicular or abdominal pocket. The electrodes are tested. The electrodes are connected to the defibrillator and it is placed in the pocket. The pocket is closed. Insertion or replacement of permanent implantable defibrillator system, with transvenous lead, S, single or dual chamber. Local anesthesia is administered. An incision is made in the infraclavicular area. The subcutaneous tissue is opened and a pocket is created for the pulse generator. The electrode catheter is advanced through the superior vena cava into the heart and placed in the appropriate site in the right ventricle or in the right ventricle and atrium. Multiple leads may be required for both single and dual chamber systems. Once all leads are placed, they are tested and connected to the pulse generator that is placed in the previously prepared pocket. All incisions are closed. Insertion of pacing electrode, cardiac venous system, for left ventricular pacing, at time of insertion of implantable defibrillator or pacemaker pulse generator, e.g., for upgrade to dual chamber system. During insertion of a pacing cardioverter defibrillator or pacemaker pulse generator, the physician gains access transvenously through the subclavian or jugular vein. A fluoroscope may be used for guidance, and a pacing electrode is inserted in the ventricular chamber of the heart, usually in the coronary sinus tributary. The electrode is connected to the generator and the generator pocket is closed. Insertion of pacing electrode, cardiac venous system, for left ventricular pacing, with attachment to previously placed pacemaker or implantable defibrillator pulse generator, including revision of pocket, removal, insertion, and / or replacement of existing generator. If biventricular pacing is required, an additional electrode is placed in the left ventricle. With the pacemaker or pacing cardioverter defibrillator already in place, the physician gains access transvenously through the subclavian or jugular vein. A fluoroscope may be used for guidance, and a pacing electrode is inserted in the ventricular chamber of the heart, usually in the coronary sinus tributary. The generator pocket may be revised and / or the generator removed, inserted, or replaced. The electrode is connected to the generator and the pocket is closed.